When we look at dental implants, it's easy to get lost in all the terminology and it can start to feel like a bunch of unrelated implant parts. But almost all of these concepts are actually solving one central problem. How do we stop restorations from rotating while still allowing them to seat passively? And interestingly, the answer changes completely depending on whether we're restoring one implant or many implants together. Every dental implant restoration consists of the implant fixture, the abutment, and the final crown restoration. The abutment connects to the implant fixture through the implant interface. Almost every modern implant fixture has an anti-rotational geometry built into this interface. The shape is most commonly a hex. Now before we continue, it's important to understand that implant systems can position this connection differently. External hex platform, where the anti-rotational geometry sits above the implant platform, always create what's called a butt joint connection. Other systems use an internal hex connection, where the indexing geometry is recessed inside the implant. Internal connections may still use a butt joint design, but many modern systems combine the internal connection with a conical interface. Instead of two flat surfaces simply meeting together, the abutment wedges into the implant with a tapered friction fit. This improves stability, reduces micromovement, and helps distribute forces more evenly. So when we talk about engaging abutments, we're referring to those that are designed to lock into the anti-rotational shape of the interface. Non-engaging abutments have a design that does not interact with those anti-rotational features. An engaging abutment locks directly into that anti-rotational geometry. Think of it almost like a key fitting into a lock. This is most important for single-unit screw-retained crowns. If the abutment didn't engage the implant connection, the entire crown could rotate around the implant. The anti-rotational feature keeps the crown locked in the correct orientation. When multiple screw-retained implants are splintered together in a bridge or full arch restoration, the prosthesis itself prevents rotation. So not only is the anti-rotational feature not needed, it will cause problems. If they are used, it would be nearly impossible to get a passive fit. If the implants aren't completely parallel, it may not even be possible to see the bridge due to interferences. Now cement-retained restorations are a little different. For cement-retained cases, engaging abutments are almost always used, even for splintered bridges. The abutments are placed first before the restoration is seated. So each abutment needs a precise orientation to allow the final bridge or crown to fit properly. These abutments are designed to be parallel to each other so the restoration seats passively after cementation. And this idea becomes even more important in full arch implant dentistry. When making multi-unit screw-retained restorations, multi-unit abutments are used. There are both straight and angled versions. The straight multi-units abutments have a non-engaging connection to the implant. They create a common path of insertion. This is important because implants are rarely placed at exactly the same depth. The MUAs essentially normalize the restorative platform so the prosthesis can seat more predictably. But sometimes implants are placed with even greater angulation differences. For example, in all-on-4 cases, posterior implants are often intentionally tilted to avoid anatomical structures and increase anterior-posterior spread. This is where angled multi-unit abutments are used. These commonly come in 17 or 30-degree angulations. The angled MUA redirects the restorative platform into a more favorable orientation. Interestingly, angled multi-units are still engaging to the implant itself. The implant-level connection needs to be indexed precisely so the angle correction occurs in the intended direction. However, the restorative connection above the MUA remains non-engaging to allow passive seating of the final prosthesis. So ultimately, implant abutment connections are always balancing two competing goals: prevent rotation, while still allowing passive fit. And understanding when each goal becomes more important is really the key to understanding implant restorative design.